So our last speaker is Dr. Natalia Linou. Natalia is a policy specialist at the UN Development Program. Her current role is with UNDP's HIV Health and Development Team, focusing on the prevention of non-communicable diseases and on developing emerging work at the nexus of public health, environmental sustainability, and gender equality. Please welcome Natalia. Natalia.
Thank you very much. I'm really happy to be part of this panel. At UNDP, where I work, the two sort of ways we frame development are under the human development lens, that is about the way that development enables individuals to live lives in dignity, to expand their choices, their capabilities. It's very much a human rights frame. And then the second is the sustainable development lens, which is about ensuring that development that is being done now does not threaten the possibilities for future generations to also have the same possibilities. So I do very much think that planetary health links these two lenses very well. But it is important, like at the World Bank, the range of work we do, we're not an environmental agency, we're not the specialized health agency. It's much more expansive. We work very much on democratic governance, on crisis prevention, on post-conflict development. So it is hard to say that planetary health should be the overarching sort of framing for our organization. But I think that if we focus on two elements, integration and equity, it will be a very persuasive one for my organization. So integration, already Fanny talked about it, and this is very much what the UN is talking about in development because of the Sustainable Development Goals. So right now we have 17 goals, 169 targets, and countries coming to us and saying, how do we prioritize? How do we resource? How do we work together across sectors? And what UNDP says is we need to think about policy coherence. For example, you shouldn't be having subsidies on fossil fuels while also you're trying to cut emissions. You need to think about co-benefits across your work in terms of an investment in this area could have multiple benefits across multiple goals, the health goals, the environmental goals, the equity goals, and really invest on those areas where you do have the biggest potential for co-benefits. But what does that mean for your research? I think it means that evidence is the first step, but not enough. Really needing to think about how do politicians make decisions. And we've heard a little bit about it, that there are private sector interests, there are financial interests, but also timing. Someone brought that up in a question. If the benefit is going to come up in 5, 10 years, it's a future government that will benefit from it. So you need to be able to translate any short-term gains, political wins today, and sort of communicate that to the policymaker. And I think your evidence is critical for civil society because they will need to push for accountability. They will need to push for change. So if civil society is able to digest the evidence, simple messaging, have a single message, that will be really important. The second area is equity. So the Sustainable Development Goals very much have promised that development will not leave anyone behind, and that there will be an emphasis on reaching those furthest behind first. So for UNDP, we're taking this kind of call very centrally to our mandate is about poverty alleviation and about reducing inequalities. So does the planetary health framing promote human health on aggregate, but also reduce gaps? And I do think that there is a lot there. Obviously, the environmental justice community has talked about how pollution, how waste, how environmental degradation does not impact everyone the same. That's within countries. And across countries, as we saw in the presentation on pollution, if 92% of deaths are happening in low and middle income countries, there's huge inequity across countries too. So equity should be central. Gender should come up. Indigenous people's rights should come up. And for UNDP, an agency that embraces this more holistic view, this is really important. So I kind of want to end with saying that if you're able to bring together the social justice movement, the health equity movement, and the environmental justice movement to, call for this change, it will be important. And the urgency is now. Politicians, governments across the globe, including this country, are stepping back on many of their commitments on climate change, on sexual and reproductive health and rights. Bringing these sort of narratives together is the way forward, and we hope to be a partner. Thank you.
Natalia, thank you.